Thank you very much for inviting me to present at this One Health International Forum in Fukuoka Prefecture. I am a Regional Project Officer at the OIE's Regional Representation for Asia and the Pacific based in Tokyo. Today I will outline some of the organization's activities relating to One Health in the region. Let's dive straight in with some facts about zoonotic disease. A zoonosis is a disease transmissible from animals to humans, and a reverse zoonosis is a disease transmissible from humans to animals. Around 60% of human infectious diseases are zoonotic, and many of these originate from animals. Of course, One Health doesn't just cover zoonotic diseases. We also need to consider other health threats such as antimicrobial resistance or environmental disasters that will affect across species. Under the One Health approach, we use collaborative efforts to address diseases that threaten both animals and humans. It's important to use this multisectoral approach when we deal with zoonotic diseases and other threats that cross boundaries of animal, human, plant health. Let's not forget wildlife within that group for animal health and also environmental health. Sophie Mousset at OIE headquarters prepared this slide to show that the environment, animal and human health are interconnected, and why it's important to include these other factors such as wildlife health to preserve our future. A healthy environment that includes thriving, resilient wildlife populations is fundamental to the health and socioeconomic well-being of humans. Wildlife health is essential to sustain the ecosystems and services which humans, domestic animals and agricultural systems depend upon. Environment, wildlife and human health are interconnected and ultimately influence each other. Anthropogenic impact on the environment alters the delicate balance of ecosystems and their health. Declines of wildlife populations can have broad and substantial consequences, with impacts on pollination, pest control, food chains, soil productivity, livelihoods, biodiversity conservation. So the conversation is changing from a conventional veterinary type approach to a more holistic One Health type approach. So what do we mean in practice when we talk about a One Health approach? Really it means that we use multisectoral expertise to tackle health threats like zoonotic diseases or antimicrobial resistance. These include several key points: strategic planning and emergency preparedness, surveillance for zoonotic diseases and information sharing, coordinated investigation and response, joint risk assessment for zoonotic disease threats, risk reduction, risk communication and community engagement, and workforce development. By now you must be wondering where the OIE fits in this One Health situation. I'm going to talk a little bit more about the OIE's structure and standards, then I'll outline the multisectoral approach we use with some examples of global and regional activities. Finally, I'll talk about some new work programs at the OIE. The OIE was set up in 1924 to tackle rinderpest. At that time, the OIE was based in France, and our headquarters is still in Paris, and was known as the Office International des Epizooties. The organization has been known as the World Organization for Animal Health since 2003. The OIE has grown to now include 5 regional representations and 7 sub-regional representations. There are 182 members in the OIE in 2020. 1 delegate has 1 vote. 8 national focal points are nominated to assist each delegate. These include animal disease notification, animal welfare, aquatic animals, communication, animal production food safety, laboratories, veterinary products, and wildlife. The OIE's current strategic plan has 3 pillars: improving animal health and welfare by appropriate risk management, reinforcing trust through transparency and communication, and supporting and strengthening veterinary services at the front lines of public health. You'll notice that the 6th strategic plan runs from 2016 to 2020, and now the 7th strategic plan is being finalised. In the current trend of globalisation, animal health measures have increasing importance to facilitate safe international trade of animals and animal products, while avoiding unnecessary impediments to trade. In light of this, the Agreement on the Application of Sanitary and Phytosanitary Measures, the SPS Agreement, encourages the members of the World Trade Organization, WTO, to base their sanitary measures on international standards, guidelines and recommendations where they exist. The OIE is the WTO reference organisation for standards relating to animal health and zoonoses. The OIE publishes 2 codes, terrestrial and aquatic, and 2 manuals, terrestrial and aquatic, as the principal reference for WTO members. The Terrestrial Animal Health Code and Aquatic Animal Health Code respectively aim to assure the sanitary safety of international trade in terrestrial animals and aquatic animals and their products. The codes traditionally addressed animal health and zoonoses, but they have in recent years expanded to cover animal welfare, animal production, food safety, consistent with the expanded OIE mandate to improve animal health worldwide. The Manual of Diagnostic Tests and Vaccines for Terrestrial Animals and the Manual of Diagnostic Tests for Aquatic Animals provide a harmonised approach to disease diagnosis by describing internationally agreed laboratory diagnostic techniques. The OIE regularly updates its international standards as new scientific information comes to light, following its established transparent and democratic procedures. Standards are adopted via approval of the World Assembly of Delegates meeting in May each year at the OIE General Assembly. The OIE has also produced a library of recommendations and guidelines which can be of use to support veterinary services. These include veterinary education, focusing on the core curriculum for veterinary education establishments, and also Day 1 competencies for veterinary graduates. Similarly, there are guidelines for veterinary paraprofessionals, an important part of the veterinary services in many countries. There are guides for twinning projects in veterinary education, veterinary statutory bodies and laboratories. The OIE tool for evaluation of the performance of veterinary services, the PVS pathway, is useful to identify gaps and identify how best to improve veterinary services in a member state. The OIE publications are available on the global website at www.oie.int. The 5 regional representations also have their own websites. These are used to highlight materials and information that is more relevant for the region. For the Asia and the Pacific region, our website is www.oror-asia.oie.int. For many of the key areas covered by the OIE, there is a portal on the website. For One Health, the global web page is www.oie.int/OneHealth. This includes an overview of what One Health is and links to related topics. Many of the infographics used in my presentation are on this portal, so you can find them to use for your own communication materials. I mentioned earlier that we should use a multi-sectoral approach when addressing One Health issues, but what does this mean in practice? One Health is a collaborative, multidisciplinary and multi-sectoral approach that can be used to address health threats at the human-animal environment interface. At the core of the One Health concept is a global strategy for managing risks at the animal-human ecosystems interface. The Food and Agriculture Organization of the United Nations, FAO, the OIE and the World Health Organization, WHO, established a coordination mechanism in 2010 by releasing a tripartite concept note. The tripartite partnership fosters better coordination amongst the three organisations to consolidate fragmented efforts at global, regional, national and subnational levels to effectively address health risks at the animal-human ecosystems interface. In 2018, the three Directors General of the organisations signed a Memorandum of Understanding to strengthen their partnership to address three priorities: zoonotic influenzas, antimicrobial resistance or AMR, and emerging and endemic zoonotic diseases, including rabies and foodborne diseases. The emphasis is on strengthening health systems. The tripartite has published several documents for countries to strengthen their multi-sectoral coordination mechanisms and to address health risks using the One Health approach. A major publication from the tripartite is the Tripartite Guide to Addressing Zoonotic Diseases in Countries using a multi-sectoral One Health approach. This document was produced by the Global Tripartite and published in 2019. It is commonly known as the Tripartite Zoonosis Guide, or TZG, and is available online at both the global and regional OIE websites. The TZG is designed to take action against zoonoses and other health threats like AMR and food safety at the human-animal environment interface. It is designed to be used by countries and includes all relevant sectors in the approach. Best practices for implementation are included, and it is based on experiences in countries. The guide provides guidance and operational tools to build national capacities in several areas: multi-sectoral One Health coordination mechanism, planning and preparedness, surveillance and information sharing, investigation and response, joint risk assessment, risk communication, and workforce development. It also includes guidance for monitoring and evaluation of these activities. Besides building national capacities in these areas, the TZG also gives guidance on how to make the best use of limited resources. By improving the efficiency and effectiveness of zoonotic disease management, costs are reduced by avoiding duplication of activities, societal losses such as poorer nutrition or restriction of trade and tourism are reduced, health outcomes are achieved, and performance is improved by improving synergies and coordination. Recently, a free online training has been created by the Global Tripartite to help you, as an advocate or an implementer, to navigate the TZG. As with the Global Tripartite, the Asia-Pacific Regional Tripartite works under the One Health umbrella, focusing in particular on AMR, rabies and zoonotic influenzas such as avian influenza, through promoting cross-sectoral collaboration. The Regional Tripartite comprises the regional offices of the three international organisations, FAO, the OIE and WHO. The partners have strengthened multi-sectoral collaboration in Asia and the Pacific region through jointly organising regular regional workshops since 2010. Our focus recently includes emerging zoonotic diseases, human rabies transmitted by dogs, AMR and food safety. Regional tripartite webinars on rabies have been organised in 2020, covering the South Asia region in May, and a regional event for World Rabies Day on 28th of September. In June, we held a regional event for World Food Safety Day with the Tripartite and the World Food Programme. 18th to 24th November is World Antimicrobial Awareness Week. This year we organised a webinar with the Tripartite and UNEP. There are many activities undertaken by the OIE which use the One Health approach. Topics covered include those already mentioned and also wildlife health, performance of veterinary services, neglected zoonoses, and transboundary animal diseases. This photo is taken from the 8th Asia-Pacific Workshop on Multisectoral Collaboration at the Animal-Human Ecosystems Interface, which took place in 2019 in Bangkok. I already mentioned the PVS pathway to assess veterinary services in a country. There is a similar assessment for human health conducted under the International Health Regulations. The OIE and WHO arrange national bridging workshops to connect these two assessments and facilitate multi-sectoral collaborations within countries. Frequently, the OIE and partners will collaborate to produce infographics with important messaging, such as this one on food safety in COVID-19 times. These images depict various activities for AMR. At the meeting in 2019 in Bhutan, discussions on the antimicrobial supply chain were teased out to assist with monitoring of antimicrobial use. Many of the OIE communication materials have been translated into other languages for use in the region. These are available on the regional website. The regional tripartite has also produced videos on AMR for use in the region, one released in 2019 on Don't Let Antimicrobial Resistance Take Control, and one released in 2020, Stop the Spread of Antimicrobial Resistance. It's more important than ever to have communication materials that can be disseminated via the internet, because of course these days most of our events are online. The first disease example I'm going to talk about is rabies, a fatal disease where over 95% of human cases are related to dog bites. For rabies, there is a global tripartite initiative in collaboration with the Global Alliance for Rabies Control, or GARC. The goal is to end human deaths from dog-mediated rabies by 2030, 0 by 30, and a global strategic plan has been developed. The first objective is to reduce human rabies risk by effectively using vaccines, medicines, tools and technologies. The second is to provide guidance and data to generate, innovate and measure impact. The third and final objective is to harness multi-stakeholder engagement to sustain commitment and resources. In conjunction with various in-country activities, the regional tripartite is very active with joint events. In 2020, these included a webinar series for South Asia members and a webinar to highlight World Rabies Day. Usually the OIE also organises hands-on training and laboratory training for rabies. For example, last year, Dr. Tu and his team from the OIE Reference Laboratory for Rabies in Changchun, China, provided training in both the Philippines and Malaysia. This year, the OIE recently organised a virtual laboratory training course for the SARC members, with training provided by Dr. Isler and his team from the newly accredited OIE Reference Laboratory for Rabies in Bangalore, India. It is hoped that the follow-up training can be done as a practical hands-on workshop, but that will of course depend on COVID-19 related safety surrounding travel and group meetings. I think everyone is very aware of the growing importance of antimicrobial resistance, both globally and in the region. The OIE and partners have produced many documents to counter antimicrobial resistance. The OIE strategy on antimicrobial resistance and the prudent use of antimicrobials was published in 2016, in line with the Global Action Plan on Antimicrobial Resistance. Thanks to the antimicrobial use team at the AMR and Veterinary Products Department at OIE headquarters for these next few slides. Each year, OIE members submit data on antimicrobial use in animals. This is then analysed and a report produced. The fourth report was published early in 2020. The fifth round of data collection is now being analysed, with the report expected in early 2021. The sixth round has already been launched in September 2020. In March and April this year, a webinar series was prepared for the region on antimicrobial use data collection. The presentations are available on the regional website. This graph from the fourth report shows the amount of antimicrobials used in terrestrial and aquatic food producing animals. The y-axis shows the milligrams of antimicrobial agents per kilogram of animal biomass. Unfortunately, you can see that the Asia-Pacific region has the highest antimicrobial usage in animals at almost double the global average. Another concern is the use of antimicrobial agents for growth promotion in animals, AGPs. This chart shows a number of antimicrobials used for this purpose, with the number of countries reporting use. 35 of the countries are still using AGPs, with 9 of these in Asia. The OIE is encouraging countries to phase out the use of antibiotics for growth promotion in the absence of risk analysis. It is really important to develop communication materials for stakeholders to raise awareness about AMR. This set of infographics were developed to show good practices for antimicrobial use, following the 5 only rules. So only use antimicrobials when associated with good animal health care. Only use when needed. Antimicrobials do not cure every infection. Only use antimicrobials when prescribed by a veterinarian. Only obtain antimicrobials from authorized sources and retailers. And only use the dosage and follow the length of treatment and withdrawal period as described. You can find out more from our regional events and activities from the regional OIE website. There's a dedicated page to AMR activities and information. This contains links to materials from earlier events. For example, the OIE has conducted 13 in-country workshops in the region on monitoring quantities and usage patterns of antimicrobial agents in animals. 9 seminars have been held for containment of AMR for veterinary education establishments and the livestock and aquaculture industries. As I mentioned, in March and April this year, a series of webinars were organised to provide information on the database on the use of antimicrobial agents in animals. And in July, we reviewed implementation of action plans for AMR with East Asia members. World Antimicrobial Awareness Week is held every year from the 18th to the 24th of November. This year, the regional office organised webinars on responsible and prudent antimicrobial use in aquatic animals and in companion animals. The OIE also supported in-country activities such as translation of communication materials into local languages. This poster is in Nepali. On 24th of November, the Regional Tripartite plus UNEP organised a webinar aimed at students and young professionals, the future generation of antimicrobial stewards. One area which has gained focus in 2020 is that of wildlife health. The OIE has always included wildlife in their remit for animal health and welfare. However, now more than ever we are seeing the need to work in a One Health manner when considering wildlife. To that end, the OIE has developed a wildlife health management framework. Thanks to colleagues at OIE headquarters and also Wildlife Working Group member Rupert Woods for some of these slides on the framework. The risk of emerging zoonoses is amplified with an increase in human-wildlife-livestock interactions. There are complex transmission pathways at the human-animal environment interface. These have impacts on health, social economic systems, biodiversity and sustainability of food systems. The main amplifying factors are deforestation and other land use changes, intensified agriculture and livestock production, antimicrobial resistance, illegal and poorly regulated wildlife trade, and climate change. This year, the OIE Wildlife Working Group has been working hard to prepare information to share with stakeholders. Output has included a statement on wildlife trade and emerging zoonotic diseases, videos from members of the working group, and joint guidelines prepared with IUCN, SSC and WHSG for working with free-ranging wild mammals in the era of the COVID-19 pandemic. A number of infographics have also been prepared by the OIE Communication Department to give advice about best practices relating to hygiene when interacting with pets and aspects of wildlife trade. Notably, this image reminds stakeholders about the interactions between human health, animal health and welfare, and biodiversity. This infographic is aimed at members of the public who may eat wildlife. In some cases, this is necessary for the human's survival, and the OIE is providing advice on good practices to avoid transmission of wild animal diseases. To assist in combating this, the OIE is developing a wildlife health management framework. The framework has a number of objectives, sub-objectives, outcomes and outputs. The overall objective is to preempt, reduce and manage the risk of spillover events of pathogens between wildlife, domestic animals and humans at the human-animal ecosystem interface. There are two sub-objectives that will assist in achieving the bigger objective. Firstly, for OIE members to implement best practices in wildlife health management for wildlife trade and sustainable use of wildlife. And secondly, for OIE members to improve capacity for prevention, early detection, mitigation and notification of pathogen spillovers. If achieved, it is hoped that this will lead to some outcomes, including 1. To strengthen multi-sectoral collaboration and capacity in integrated wildlife health management and surveillance systems. 2. To foster an enabling political and policy environment for veterinary services. And 3. To increase awareness and knowledge of key decision makers and stakeholders about risks and their mitigations. There will also be 6 outputs. 1. Promotion of multi-sectoral coordination and collaboration. 2. Reinforced capacity in wildlife health. 3. Improved quality data collection, reporting, analysis and use. 4. Updating and development of guidelines, standards and risk reduction strategies. 5. Development of dissemination of scientific knowledge. And 6. Production and dissemination of awareness tools. The one of most interest to the Working Group for Wildlife is number 4, specifically a set of guidelines, identification of standards and risk reduction strategies. To accomplish One Health in action against emerging diseases, we should remember that veterinary services play a role in preventing spillover events through careful surveillance of wildlife and wildlife trade. The OIE supports building resilience against future health crises. To show how important wildlife health is to the highest level of the OIE, this is a message from Dr. Monique Eloi, the OIE Director General. The OIE will act through enhancing wildlife surveillance, strengthening veterinary services and wildlife sector relations, and developing standards on wildlife trade to reduce the risk of disease spillover events. Environment, wildlife and human health are interconnected. Let's remember to consider all sectors when we are working together. Let's build bridges across sectors and work together for One Health. Thank you very much for your attention today. Please follow the OIE on social media to be kept up to date on the organisation's work.